Hello everyone. Welcome to the latest Rural InReach Westlink presentation on menopause. My name is Janet. I work as a registered nurse in the clinical program at Women's Health and Family Services, and I also work as a health consultant for Rural InReach. I'm very happy to be here today. I'm even happier because I have with me Joan Forward, who is the Manager of Clinical Services and has extensive experience. I'd like to pass you over to Joan, who is going to talk a little bit about herself.
Hello everybody, thanks Janet for inviting me. I'm so pleased to be here because I also work in the clinical services, and over the last years we've had so many phone calls from women from rural and remote areas and from some men around menopause issues. So what are we going to talk about today, Janet?
Okay, so first off, we're going to talk a little bit around what Women's Health and Family Services can offer to people in rural and country areas. So starting with the medical and clinical services, Joan, would you like to talk a little bit about that?
Well, the clinical service was the first service that was started at Women's Health, and it started in the 70s and has been going for a long time. We've got registered nurses and doctors who provide information and treatment and management of many women's medical problems. We don't do general health, but we do anything to do with women's health. We also have a counselling service, a clinical counselling service, a telephone information service, where we get many calls from women from rural or remote areas. We have a nurse clinic that checks for STIs, and we will talk about pregnancy, fertility, menopause, and really any sexual health related issue.
Great, thanks Joan. Our counselling program is run by psychologists, master students of counselling and different therapies. We have a drug and alcohol service which is very comprehensive as well. That has numerous programs under that banner, and including children's counselling, mums programs, better parenting, and lots of things around that. Joan, anything else?
And our lovely Circle of Security program, which is so good, and I know so many of the mums really enjoy engaging in that, don't they?
They do,
Yeah.
It's excellent.
It's a great program.
Yeah. So we also offer information services via the phone, by email, on our website, and all these addresses for the website, email addresses, will come up at the end of this presentation. Community talks and workshops. Joan, what can you tell us about that?
We do a lot of community talks and workshops, and we do a lot from the clinic. In fact, the other day we were doing a group talk for a group of African women around women's health, and we had another excellent menopause yarning session with some of our Aboriginal clients in the northern suburbs. And of course we do these remotely as well. Other parts of the service also do talks and workshops, and really they can tailor-make the talks for anything the community wants, from depression and anxiety to health issues to educational talks around nutrition, and really anything that the community decides. If as long as it's to do with women's health, we can do it.
The other thing also that we offer is training and workshops for service providers. So certainly that's an aspect of our work. Professional development and training we've touched on. The Rural InReach program, we offer health and wellbeing presentations, workshops to people in rural areas, also counselling one-on-one, and we're hoping to develop that into group scenarios as well. We have a domestic violence and counselling, referral, advocacy and support service for women and their families. Multicultural Women's Advocacy Service, and we are part of the Perth West Domestic Violence Action Service. We also have a creche, so people coming to access our services can book their children into that creche. It's free, and certainly a really valuable addition to what we can offer people, especially if you're travelling up from country areas. Do you have anything to offer around those programs?
I think having the creche is probably one of the best things our service offers, because it means any woman can get the time she needs with the health professional or counsellor without her children being involved, and gives her time to look after herself, and that's what really it's all about, isn't it?
Definitely. Yeah, that's lovely. Okay, so let's move on to menopause. What is it? Joan.
Well, we know that menopause literally means cessation of periods, but menopause is one of the several transitions that women will go through in their reproductive life. Many young women will remember when they started their periods and the changes that went with that. Menopause, of course, is a completely natural transition, and it's not a medical problem. Nowadays, we find people trying to often medicalize things that are completely normal, and menopause is not a medical condition. It's a normal transition. But there are different stages of menopause, aren't there, Janet?
There certainly are. I think the important thing to remember around menopause is that good times come and bad times pass. So even if you're struggling a little bit, it is going to get better. So the stages of menopause can include premature menopause, perimenopause, menopause itself, and postmenopause. And we're going to look at those stages in a little bit more detail as we continue through the presentation. In the interim though, estrogen governs a lot of things that we do and what happens within our bodies. Joan and I will share this because it can be quite involved around what estrogen actually affects and how it works. And the one thing that we need to remember around menopause is that estrogen starts to decline from usually within our mid-30s and onwards, and gradually diminishes over time to what we call the natural menopausal age of around 50. So Joan, what happens with our brain?
Well, I think we all know what happens with our brain. We often start to forget something. People think, where did I leave my cup of tea? In fact, Janet, I found my cup of coffee this morning in the linen cupboard. I hear people often saying, I went into a room and forgot what I went into. So estrogen definitely affects our brain. It also affects our eyes and our teeth. And you often find women and men as they get older, but you find them needing to have glasses. In any restaurant, you'll see people of middle age fishing for the glasses before they start to look at the menu.
True.
And then there's the teeth. We don't realize how much estrogen affects dental caries, and diminishing estrogen does lead to more teeth decay. But probably heart is the thing that we need to be most aware of, because our risk increases so much more, doesn't it?
It does, because estrogen has a protective factor for our heart and cardiovascular system. So it stands to reason that as our estrogen levels are dropping, then that protective factor is actually decreasing or diminishing. With our breasts,
estrogen affects density of breast, doesn't it? And so one of the big things about screening breasts is that you can have a mammogram as you get older, and we'll talk about the screening more later. But mammograms are not good for young women because breasts are so dense. But with diminishing estrogen, breast density is decreased and mammograms become much more easy to detect abnormalities in the breast.
Yeah. Also, the incidence of cancers occurring in the bowel tend to increase around midlife as well, particularly for women. And it is one of the main causes of death in women around midlife. So certainly estrogen has an effect on that particular part of our body as well.
So we need to be really careful that when we get the envelope in the mail about testing for bowel cancer, that we don't ignore it, don't we? Because there's a big campaign at the moment around checking for bowel cancer.
Definitely.
Yeah.
Yeah. I think that's 55, isn't it? They tend
55.
to send that out. But if you have a history of cancer, bowel cancer in your family, you can access that test prior to that age. Or if you're concerned, if you have any change in your symptoms or you develop symptoms, then certainly you can access that.
Yes.
And that's often a precursor for further investigation, which can lead to life-saving treatment.
And colonoscopy is the benchmark, isn't it?
Yes.
Yes. And nobody particularly likes one, but it can save your life.
Yeah.
But then we get on to the urogenital tract. And this is probably one of the areas where women will come to see us most frequently. Changes to the urogenital tract. So passing urine more frequently, discomfort with intercourse, and sometimes for some women some cracking in the vaginal area and around the labia, which can be very, very uncomfortable. But I think we're going to talk a little bit more about that later on, aren't we?
I think so, yes. So we'll move along from here. Or potential symptoms of menopause. Now, it doesn't mean, because we've got a big list, that you're going to succumb to all of these. You may have some, your friend may have others, your mother might have suffered from completely different symptoms. Everyone is variable. I think what we have to remember is that we are all unique, and so we will experience different passages throughout our life in different ways. Yeah.
I would say, though, that hot flushes are the reason people most frequently contact our service, and especially if they're keeping people awake at night. In fact, I had one man who phoned it up a couple of months ago, and he was complaining that he couldn't sleep because it was clothes on, clothes off, clothes on, clothes off in the bed, and he just said every night he didn't know whether he was hot or cold because his wife was having so many hot flushes. She was putting the duvet on and off, so it was awful for both of them. And of course, if you're not sleeping well, things like anxiety and depression can be increased.
Definitely. Okay, so dizziness certainly can happen. People become a little bit, it's almost like having vertigo, but not quite. So it's very uncomfortable sensation. Palpitations where your heart races for no real reason often can be associated with hot flushes. As Joan's mentioned, altered sleep patterns. Sometimes, and this still happens to me occasionally, I will feel like I haven't slept all night. I have, but it's a different level of sleep. So you don't get that refreshing sort of sleep, and you wake up in the morning feeling like a bit of a limp dish rag.
So it would be no wonder you would have some forgetfulness then the next day if you hadn't slept properly.
Yeah, definitely. And be feeling a bit anxious and maybe a bit depressed about it all as well.
Yeah.
Yeah.
But most people won't get all of these symptoms. Most people will just get, probably 20% of people won't have any symptoms whatsoever, and 20% will have quite severe symptoms.
So most of us tend to fall into the middle group of 60%, where we have some of those things, which means in that case we can generally manage those quite well. Okay, so we'll move on. We've mentioned most of those, and as we've said here, the 20, 20 and 60 rule tends to work for the female population.
And it's really a problem if it's causing a change in your life, isn't it? That's when you would really look for some help.
Sure. Right, premature menopause. Okay. This occurs before the age of 40 in a woman. It can be natural or surgical. So surgical obviously is where the uterus and or the ovaries are removed. So the ability to manufacture that estrogen is removed.
And women would then get very severe symptoms, I suppose.
They can do. That can happen if you do have a surgical menopause. A natural menopause, certainly women do seem to also experience more severe symptoms as well. So quite uncomfortable for them. And really, though, it's a small proportion of the population, around about 5%. Will experience that premature or early menopause.
Yes, yeah. So I suppose in that case there'll often be a younger woman, and just thrown into it very quickly can lead to quite distressing symptoms. So they would be the women who would probably need quite a bit of help and intervention.
Yes, they do. The other thing too, I think, to remember around this is that unless you have a pre-existing condition that would lead to a surgical intervention before 40, a lot of women now are actually leaving the birth of their children until their 30s.
Yes.
Okay, so in that instance, having that awareness around your fertility and what's going on for you is very important.
Yeah, I agree with you, Janet, because I would say in the clinic, in the last couple of years, we've had more distress from women who have thought that they could have babies way into their 40s, because they've seen so much stuff on TV about people having babies at 45. But in actual fact, from 35 on, our fertility is significantly diminished.
Yes, definitely. Yeah. So we have already said that symptoms may be more severe if women have a premature menopause. What we have here in front of us now is a menopause evaluation sheet, and we're putting it in here because if you think that you are developing symptoms, even regardless of your age, you can actually use this sheet. It is available on our website. I would suggest you download it if you can. You can certainly access us and we can post it out to you if you don't have access to computers or you're not interested in computers. But what it will do, it will give you the ability to look at the symptoms that are listed as coming along with the menopause.
And just evaluate.
That's right.
I've actually used that over the phone with someone the other day and they found it really useful. It's a great little sheet to kind of identify where you are.
Sure.
Yeah.
It is. It's great.
And you can get it on our website, can't you?
You can.
Yeah.
Yes. So that's available on the Women's Health website and also the Rural InReach website. This is how you do it. So if you have no symptoms, you put a 0. If you have mild symptoms, you put a 1. If they're moderate, you put 2, and if severe, you put a 3. Then you total them up at the end of the page. If you have a score of 15 or more, then that's an indication that your estrogen levels are declining, and I would suggest then a visit to your doctor or your health provider in your area.
As we age, estrogen decreases all around our body, but it's particularly evident for women around the pubic area, the vulva and the vagina. And this often causes significant stress for women, especially if they're in a sexual relationship and there is discomfort with intercourse. Starting with pubic hair, the thing that most people notice is a thinning of the pubic hair. With the vulva, the labia and the vagina, estrogen keeps that area moist and lubricated, and as it decreases, the area can sometimes become cracked and sore. And for women who are having intercourse regularly, that keeps the vagina more opened. But if they're not having intercourse, slowly over a number of years, the vagina becomes more stenosed, and having a pap smear can become uncomfortable. So it's a really, really good idea to talk to your doctor about it, because you can use localized estrogen to make a really big difference to that area. Cracking with intercourse can be very, very painful, and what we often find is that women will come in and say that they're avoiding intercourse with their partner. In fact, there's a pillow down the middle of the bed, and they're not having the conversations they need to have, and that many of the partners are feeling sad and rejected and not understanding. So it's a very important part of life, isn't it, Janet, to talk about your partner about these things?
Yes, yeah, sure, absolutely. I think what we have to remember here is that men need sex to feel loved and women need to feel loved to have sex. So if you're not having that open discussion with your partner, then that's where misunderstandings and ill feelings start to creep in.
And fighting about things that aren't important when it's really about intimacy.
That's right.
Yeah, it's a very important part of our lives.
So sexuality changes. Okay, so it stands to reason as our estrogen declines, our interest in sex may also decline. So this is when we have what we call change in libido. Usually within a relationship, one partner will have more, more desire than the other, but they manage quite well around that. There's a lot of give and take, and if you are open and honest with each other and communicating well, then that doesn't become an issue. With menopause, however, and all the dryness of the vagina, the cracking of the skin, the lack of lubrication, Joan has already mentioned that can be very off-putting for a woman to actually want to have sex or intercourse with her partner. So,
And for the partner, I had a man actually phone a couple of months ago, and he was saying that he felt, though he wanted to make love to his wife, that it caused her so much distress that he was having problems sustaining an erection because he was aware that he was hurting her. And really this was a couple who were really in crisis around intimacy. And it was amazing, after some localized estrogen and some permission to talk about what was going on for both of them, made such a difference to what was happening. Neither of them really understood what was happening.
Sure, yeah. That's really valuable to know that. But one of the things that we would recommend if someone actually was in that situation as well, who actually had a discrepancy between their desire levels brought on by menopause, is to look at decision-driven sex, which is basically talking about it, making it a choice, setting the scene. So maybe a nice dinner, perhaps having a glass of wine. It's having no stressors around you at the time. So
setting the scene.
Definitely, yeah. So making it a conscious decision to actually have that intimacy with your partner on a particular day at a particular time. And just setting that up will open that door to communicating more openly and freely around what's going on for you and what's going on for your partner.
I think Dr. Rosie King does a beautiful book on that, Good, Loving, Great Sex, and she talks quite a lot about decision-driven sex as opposed to mercy sex, where you just lie there and give in because your partner is desperate. And nobody enjoys that very much. But at this stage of life, Janet, many women will not have partners.
Yeah.
And that can be a problem too. So I think it's really important for women to know that it's absolutely fine not to have sex. Some couples are in a relationship where they feel comfortable just being emotionally intimate, but not necessarily physically intimate. And that's not uncommon as people get older. But for people who don't have partners, who also have desire, it's fine to use sexual toys, it's fine to use sexual lubricants, sexual play for self is absolutely fine. And some people find it hard to talk about this with their health professional and often feel quite embarrassed about the topic, don't they?
They do. We find working at Women's Health and Family Services in the clinical area that we receive telephone calls around this particular area of sexuality, because people feel comfortable talking over the phone sometimes
and being anonymous
than face to face. But certainly we do get women coming in to the clinical area with that as well as an issue.
So nothing is abnormal.
No. Okay, so also what's happening around this stage of our life is that we're at midlife. So we're generally, around our 50s-ish. All our children may have left home, and we may be feeling the loss around that.
Yes.
Sometimes it's a real boost as well. You can feel absolutely amazingly free. Our partner may be ill, because it stands to reason if we're getting older, they're getting older as well. We may have lost our partner, as Joan has mentioned, or we don't have a partner at all at that stage. We may be looking after elderly parents. We may have lost one or both of them. So that we have a lot of change going on in our lives, and certainly there are some more, aren't there, Joan?
And at this stage, often we may be mixing a couple of these things. Because sometimes you could be doing all of 2 or 3 of those things. So there's often a lot of change going on in our lives. But by this stage of our lives, we're mature women. We've experienced a lot, we know a lot of things, and we have a way of managing life. So they're the ways that we have to continue with dealing with any of the stresses we have. One of the biggest things that women are talking to us about at the moment are financial difficulties, and we know for people living in rural areas, the lack of rain for farmers has caused huge amount of stress. So financial difficulties affect every part of a family life. And then many of the women are talking about getting jobs again and re-entering the workforce with skills that are so inadequate for the changes that have happened over the last years. And that can be very stressful.
Absolutely.
Especially technology.
Yes, yeah. And then of course living in rural areas, in some areas there won't be the availability of jobs.
That's true.
In those towns. So certainly it is a huge stress for people. So managing change. How do we do that? It seems like sometimes you're just crowded in with lots of different information. I mean, there are definitely two schools of thought. One is exclusively medical and one is completely alternative. So what do we do? How do we make it work for us the best way when in actual fact they seem to contradict each other at times?
I suppose the big thing is, what's going on for you? What are your symptoms? Are they manageable? If your symptoms are manageable, how easily can you manage them? If they're not manageable, then maybe we need to look at some lifestyle changes, some natural therapies, or even some short-term hormone replacement therapy.
Yeah, they all sound great. So self-help, I mean, there are lots of things we can do, and certainly if you're succumbing or suffering from hot flushes, what I would suggest is trying to layer clothing, and generally I would suggest, if you can, use natural fibres. It stands to reason that if you have a polyester shirt or jumper on and you have a hot flush, it's going to act like a thermal insulator and you're going to become hotter and feel like a volcano. Use cotton blankets instead of a doona, or what I do is have cotton sheets, cotton blanket, then the doona, so I can always throw off one or three of them depending on how things are going. Cut down on your hot drinks. Everyone knows that a cup of tea on a really hot day is cooling because you break out in a hot sweat, and your body then cools itself down. But it stands to reason when you're having a hot drink and you're having a hot flush, the same thing is going to happen, but you feel hotter. Look at your alcohol. Alcohol, of course, leads to hot flushes or feeling hot after you have drunk alcohol. And also try and increase the phytoestrogens in your diet, because these are a natural way to actually try and manage that temperature regulation in your body.
I will say to women who come in to see me, when they're going to a meeting, have a large glass of cold water, wear slip-on shoes, and if they feel a hot flush coming on, slip off the shoe, put the foot on the cold floor, and sip the water. No one will know, and you'll cool down very quickly.
Instead of what I normally do, which is grab anything
and fan.
And fan frantically. Okay.
So one of the other things that we can do, and there is some evidence to show that having phytoestrogens in a diet can make a big difference. But looking at menopausal life, or life post-menopause, what we need to do as women, we need to look after ourselves. We know that we need to increase calcium and vitamin D in our diet. As we age, our bones become thinner, and it's really important to have sufficient calcium intake and vitamin D level. And despite living in Western Australia, where there's so much sun, often we find the slip, slop, slap message has been too good and vitamin D levels can be low. So it's really important that we have calcium and vitamin D. Increasing phytoestrogens, decreasing caffeine and alcohol. And the reason we should decrease caffeine and alcohol is because they wash calcium from our body. We need to eat some protein, and I think, as we were talking before, Janet, a handful of protein. And protein is terribly important for our muscle strength, and we need good muscles to maintain our bones in place and to make sure that we're protected from trips or falls. Low fat, low salt, and low sugar. Very important.
Yes, unfortunately not rocket science, but sometimes difficult to do when you've got a delicious chocolate waiting for you after dinner. But a little bit of chocolate is fine, dark chocolate preferably. It doesn't mean no treats, it means moderation.
Yes.
Maxine, she's great. Her secret for keeping her figure, getting everything to droop at the same rate. As she's eating a big piece of cake, I might add. So lifestyle changes. Okay, so basically looking at lifestyle and working out what works for you and what doesn't, and obviously doing more of what works. It could mean an exercise regime, it could mean chatting to a friend, it could mean
having fun.
Yeah, doing things that make you feel good about yourself. If you're all work, no play, try and readjust that and have a little bit more play and maybe a little less work if you can manage that.
Yeah, allowing yourself. Because I think often women are inclined to be so busy looking after, they forget that it's important to do nice things for themselves too.
Definitely, that's
and that
true.
Certainly will decrease tension and anxiety and any of those feelings that come with menopause.
That's right. So basically giving yourself permission to take time out if you need it.
Yeah. I think that's so important.
Review your coping strategies. And I think for women, most of us are talkers. Quite a few of us are talkers. I won't say most of us, but one of the things that women I speak to mostly like to do is to chat. They like to talk to someone who gets them, who is empathetic, maybe experiencing a similar situation, and that's very important to have that as an outlet.
I think that's the difference between men and women talking. Men will often want to help you solve the problem by giving you ideas of what to do, whereas women will just hear the problem. And I think that's why cup of tea friends or cup of coffee friends are so important for women. And I think that's another thing at this time of life. Often you find people move away, so establishing friendships and belonging is a terribly important part of this transitional part of life.
Yeah, it is. Definitely exercise is important. It helps give us a natural high through release of endorphins if it's fairly physical or vigorous exercise for at least 30 minutes a day. If you can manage that, it's great for our bone health if it's weight bearing as well. So
and our hearts.
And our hearts, definitely. Yeah. And the last thing is, Joan said, have some fun. You know, have a laugh. It's great for the soul. Makes you feel really good. Okay, on to tests.
So, looking at the screening tests, every woman should allow herself to have the screening test she needs to be healthy for the next third of her life. Mammograms are free. Start having them at 50. Continue having a pap smear every 2 years. In fact, what I recommend is sometime in the week around your birthday, have your mammogram, your pap smear every 2 years. And for your 50th birthday, give yourself a present of a bone densitometry. Now, these aren't free. There's a gap of about $70, but it lets you know what your bone status is at 50. And that will determine how strong your bones are and whether or not you need to have some some prevention of osteoporosis later in your life. If you've got a family history of osteoporosis, it's particularly important. It's also important to have a cholesterol check. This is the time when women become more at risk of heart disease. So have your cholesterol check, see what your status is. We also suggest that you may like to have an FSH level, which stands for follicle stimulating hormone. What this does is establish how hard your ovaries are working to produce your estrogen or E2 level. And it's also really important to have a blood sugar level because in Australia, the incidence of diabetes, type 2 diabetes, is going up all the time. So get yourself checked out and see where you are at 50, and then continue the mammograms and pap smears every 2 years until you're 70.
Great. So natural therapies. There are natural therapies out there on the market. We've all heard about them. We've had friends who've tried them. We may have tried them ourselves. What we need to look at though is which ones are matched with which symptoms. So for hot flushes, on the market at the moment you can buy Remifemin, which is black cohosh, and Promensal. Another one for hot flushes is sage.
That's right.
Yeah.
Have you ever drunk sage tea, Janet?
I have. It's disgusting. Very bitter. But it's out there as being something that people can use. Remifemin has had some bad press around liver toxicity. So be very careful with the amount of that one that you're taking, and if you have any symptoms that you're uncomfortable with, and certainly get yourself checked by your doctor.
Promensal is advertised a lot. I see Lisa Curry Kenny had been saying that Promensal really helped with her hot flushes. But when I looked at the Menopause Society, they said there was very little evidence that there was long-term gain from any of these natural therapies, except for St. John's wort, which has been shown to help with mood. But that's the only thing it helps with. It doesn't help with hot flushes. I think that's one of the big things, Janet, with therapies. Very few natural therapies work for everything. And I think that probably leads us back to the stuff around hormone replacement therapy, doesn't it?
Almost. I just want to touch on Yam Cream.
Ah, yes, the Yam Cream that was going to make us all look beautiful.
Yes.
It really is just a moisturizer, isn't it?
Yes.
Yeah.
So you put it onto your skin hoping that it's going to give you a hormonal boost, and in actual fact it just moisturizes your skin and keeps it nice and soft. So not entirely successful at all. And moisturizers too. The dry vagina and the cracking of the skin around the vaginal area on the vulva is one of the most uncomfortable things that women experience around midlife or menopause. So Replens actually puts back
it's wonderful.
the moisture inside the vagina. Silk is actually a lubricant, so that's beneficial, and there are lots of other ones available, such as KY jelly, which is readily available anywhere. Silk and Replens are, I think, quite costly, but KY jelly as a lubricant is affordable. It's in your supermarket. The one to avoid is Vaseline.
Petroleum jellies is for cars, not vaginas.
That's right. So no Vaseline around that part of your body. Okay, we're moving right on then to hormone replacement therapy. And we can talk a little bit about these. They take the form of pills, patches, gels, pessaries, which are inserted into the vagina, and troches, which is the natural alternative, as in made by a compounding pharmacist. And they are actually little, like gum that dissolves and is put inside your mouth up the top of your teeth, between your gum and your teeth. So anything else to add to those?
There's been a
Joan?
lot of talk about pills, hasn't there, over the years. Really, hormone replacement therapy is the one thing that works for everything. It works on bones, it works on hot flushes, it works on mood, it works on all the symptoms of menopause. Unfortunately, due to some negative research that came out about 10 or 15 years ago, many of the pills that were available on the PBS are now not available. So mostly doctors are prescribing patches, hormone patches, or gels. Both work really well for symptoms. And for those 20% that we discussed earlier, where the symptoms are affecting the day-to-day life of the woman, using hormone replacement therapy short term is certainly an option. And the other thing, Janet, that's talked about quite a lot is Tibolone, and that's another tablet, but it's slightly different to general hormone replacement therapy, and it's also an excellent excellent way to stop symptoms. And I was told the other day that most doctors or doctors' wives who need hormone replacement therapy take Tivolone because it's been shown to be breast neutral.
So that's important to
I
know
think
that
we
one.
should talk a little bit about the troches. They are natural hormones, but there is so little research on them. We don't know what they do. And a lot of women are hooked into believing because it's considered natural that it must be good. The problem is there is no research. Whereas at least we know with the other pills and patches, the research has been done by reputable bodies.
Sure, yeah. There was, however, and I think this leads into our next slide, about the research that was carried out by the World Health Organization. So as we've said here, hormone replacement therapy is the only evidence-based treatment for menopausal symptoms that has a much greater effect on symptoms than placebos, for example. This study that was done, it was done over 5 years with 10,000 women taking hormone replacement therapy. It resulted in 7 extra heart attacks, 8 extra strokes, 8 extra breast cancers, 18 extra blood clots, but 8 less bowel cancers and 5 less hip fractures. However, the study was flawed.
It was flawed, wasn't it?
Yeah.
Because it was done in the States with a cohort of women who were over 60. So these are women who would never have hormone replacement prescribed for them initially in Australia, and many of the women already had heart disease and were obese, and some of them smoked. They're a complete counterindication to putting someone on hormone replacement therapy. But unfortunately, this research will never be replicated because of the results of the Women's Health Initiative study and the outcome. They won't do it again. So tread carefully. See your doctor. If you've got symptoms, please don't suffer in silence, because there is a good way to manage the symptoms of menopause.
Definitely, absolutely. Maxine, of course, she'd consider hormone replacement therapy, but she's got a bunch of other things that need to be replaced first, as do we all. The Menopause Mantra. Every woman is an individual, so she needs an individual assessment to meet her individual needs. Please see your doctor, talk about what's going on for you, ring us, come and see us. We give preference to country clients who can travel to the city for consults. Our doctors are all female. They have specialised in this area. They have chosen to do that. That's where their interests lie. So they have many, many years of experience and knowledge. We'd love to see you. So female menopause, here we are in full flight. Bring it on. Some of the references that we have used, obviously Maxine, and we need to acknowledge her because she does play a part in our lives. Australian Menopause Society, which is also accessible on the internet. The North American Menopause Society. The Jean Hales Foundation, a wonderful organisation, have newsletters you can access, have a website, a webpage, amazing source, front runners for research. So if you need to know anything up to the minute, that's always my first go-to site. And the Melbourne Women's Midlife Health Project. This is how to contact the Rural InReach program. So our website is www.ruralinreach.org.au, and you can reach us by email on ruralinreach@whfs.org.au. And for further information, you can also contact your local Women's Health Centre, your local GP, a natural health practitioner who is accredited, the Menopause Support Association on 1800 629 799, or the Perth local number 9340 1535, the Jean Hales Foundation on 1800 151 441, or certainly by accessing the RFDS Women's Doctor Clinic. Our contact details at Women's Health and Family Services, and this applies for the Rural InReach program as well, is country call number 1800 998 399, and the Perth local number is 6330 5400.
Right, and they might even get to talk to you or me, Janet.
That's very true, and we'd love to hear from you. So thank you so much for watching us. Thank you, Joan, for coming and sharing this presentation with me today. It's been wonderful to have your knowledge and experience along with the presentation.
It's been a pleasure, and having lived so many years in the country, I know how important it is to get this message out to country women.
Okay, so we'll look forward to seeing you another time. Enjoy the rest of your day.